Good afternoon. The Health Subcommittee will come to order. Thank you so much. We have a lot of patrons before us, so we'll try to treat you as quickly and kindly as the context and the will of the committee suggests. I have a few housekeeping bills, or housekeeping matters, I guess I should say. So on House Bill 1318, oh, my mistake. I'll have the clerk call the roll, please.
Senator Durant.
Present.
Senator Aird. Senator Bagby.
Present.
Senator Suderline.
Yes.
Senator Favola.
Here.
You have a quorum, Madam Chair.
Thank you. Okay, I ask my team or my colleagues to turn to page 4 of your agenda, and the House Bill 1318. The patron is Delegate Cole, and I would like a motion to move. Basically, it would be conform Delegate Cole's bill to HB 909, which is Delegate Shin's bill.
Second.
Okay, motion has been made. All those in favor signify by saying aye.
Aye.
Aye. Okay, now I have another request for a motion. Now that I have those two combined, I would like a motion.
Did we incorporate one into the other?
Yes, we did. Now I want a motion that will incorporate HB 909 into Senate Bill 488. So we would say conforms.
Madam Chair, I would move
Senator Suderline.
that House Bill 909 be conformed to Senate Bill 488 with one exception, that on line 28, where it currently says December, change that to November. And the reason for that is in that section, there's a discussion about a report coming to Senator Lucas and Delegate Torian in their capacities as chairs of those respective committees. And I think that I want them to have that information
Sooner?
before the bill filing deadline, and the rest of us as well. So that's my motion.
Okay, and is there a second?
Second.
Okay, all those in favor of that basically date change signify by saying aye. Aye. Okay, now I would like a vote on the confirmation, because we just did the amendment. So to conform House Bill 909 to Senate Bill 488, all those in favor signify by saying aye. 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 Now I'd like a motion to report Senate Bill, to report HB 909 as amended, to recommend reporting it to the full committee.
So moved.
Second.
Okay, the clerk call the roll.
Senator Durant.
Aye.
Senator Aird. Senator Bagby.
Aye.
Senator Suderline.
Yes.
Senator Favola.
Aye.
Ayes 4, no 0.
Okay, thank you. All right, we got that housekeeping done. Okay, I see Delegate Sickles before us. Would you like to come forward? We always have the greatest respect for those on the Appropriations Committee.
Madam Chair, I thought it was because he chaired our sister committee full.
Well, that's another point. Welcome, Delegate Sickles. Would you like us to turn to 592? Okay.
Back in 2020, when we passed the prescription drug transparency law, it passed the House 99-1. That required groups involved in the chain of drug prices to report information to the Virginia Health Information Organization, which is a contractor to the Health Department. VHI has now issued 2 reports on drug prices in Virginia. Shortly after the law was passed, emergency regs were developed. Under provisions of the law, these regs were to be replaced by permanent regs. However, those permanent regs have not gone through the APA process and have not been signed by the governor. And so they expired in January. So all this bill does is say we keep the temporary regs until we get the permanent regs done. That's all this does.
It's pretty straightforward. Senator Suderline,
Madam Chair, I'd like to move that we recommend report of House Bill 592.
Second.
okay, I agree with that. Do you have any speakers or anything more you want to say?
But nobody knows about this bill, so I don't think there's anyone out there that would want to speak to it. I
Okay.
mean, maybe there is, I don't know.
Well,
Ask around.
I think I'll call the vote while we're on a roll. Will the clerk please call the roll, please?
Senator Durant.
Aye.
Senator Aird.
Aye.
Senator Bagby. Senator Suderline.
Yes.
Senator Favola.
Aye.
Ayes 5, no 0.
Thank you. We will
Thank
make
you very
that
much.
recommendation.
Okay, terrific. Have a
and
nice
help.
afternoon.
Thank you. Let me see. I know. Is Delegate Herring here by any chance? Delegate Herring, okay. And you have House Bill 781.
Thank you, Madam Chair and members of the committee. House Bill 781 is dealing with the Maternal Health Data Task Force. The task force was established 2 years ago. We evaluate state-level data sources from all stakeholders, including payers, electronic claims data to examine the quality of race and ethnicity and other demographic data and clinical outcomes. This bill was initially introduced and still before you today is because of the high rate of maternal mortality that we are seeing in the Commonwealth of Virginia with respect to Black women and other women of color, and also in lower economic areas in the Commonwealth. We have been able to collect data. There have been bills proposed this year regarding maternal health to improve our outcomes, but there's still more work that can be done, Madam Chair, and so that is why the task force was, this bill is before you. And Madam Chair, there is an amendment to the bill. Looking at the drafting of the language, this amendment just conforms it to the language that was introduced 2 years ago to make sure that we have certified nurse midwives who are appointed by the governor and 2 individuals who are licensed certified midwives in the Commonwealth as part of the task force.
Okay, all those in favor signify by saying aye. Okay, bill is amended. I think this is pretty straightforward. You're not changing in any way the responsibilities or the charge of the task force. You're merely continuing it because it concluded on December 1st, 2023.
That is correct. Yes, ma'am.
Okay. Sure, yes. Senators, go ahead. Senator Durant.
I would be remiss if I didn't point out there is one thing that jumped out at me when I'm reading this language is something pretty different. We're talking about birthing people. Are we talking about mothers? I mean, I think the language on this should be consistent with those who give birth. That's a mother.
Madam Chair,
Let me ask Delegate Herring, would you like to reply?
Yes, Madam Chair, I would like to respond. In the medical community, it is often that birthing people is used as a term. So that's why we say birthing people.
I would make it and propose a friendly amendment. to
Madam
change it to
Chair.
mothers.
Senator Aird.
I would not like to speak on behalf of the patron, but I would not consider that a friendly amendment.
I'll second the motion just because it's still out there.
All right. Senator Durant made a motion, and it's an amendment, and there is a second. We can talk about it. Again, I think you're trying to, I don't want to put words in your mouth, but you're using the accepted language that is used today in most journals and other
Absolutely.
documentation.
Madam Chair, and just the reality is that, that there are times, and this is what this bill is addressing, sometimes there is a stillbirth. And birthing people is why that language is used. So.
Okay. The amendment's before us, and that is to change birthing people to birthing mothers. Is that your amendment?
Mother. I thought it was just mother, period.
All those in favor of the amendment signify by saying aye.
No.
No.
And I have the proxy for Senator Bagby, which is also a no.
Okay, the amendment dies. All right, we're ready to make a motion
Vote
unless,
to report.
okay, is there a second?
I can second it.
All right. Will the clerk call the roll? We will report as amended and make the recommendation to our parent committee to report this bill as amended. Clerk, call the roll.
Senator Durant. Senator Aird.
Aye.
Senator Bagby.
Aye.
Senator Suderline.
Abstain.
Senator Favola.
Aye.
Ayes 3, no 0, abstentions 2.
Thank you, Madam Chair.
Thank you,
Thanks to
Delegate
committee.
Hearing.
Thank you.
Okay, let's see, next is, I think Delegate Shin, you were here before Delegate Hope.
Thank you, Madam Chair.
And we're looking at 908, right? Okay.
Correct. Madam Chair, before, I understand that there is a substitute that has been prepared, but before we move the substitute, I would like to explain the intent of the bill and what we are trying to do here, and then we can talk about what the substitute does on top of that. Because 908 is a substitute or a cognate to Senate Bill 676, which was heard here earlier this session, and it was amended in Senate Finance, and so I think that that's some of the work that's happening here with the substitute. As introduced, the bill before you directs DMAS to amend the financial eligibility standards for certain waivers providing services to individuals with developmental disabilities, so that Social Security disability income is disregarded by the department when calculating the individual's financial eligibility for the waiver. I'm going to go off script a little bit and explain to you what we've been working on for a couple of years, because I think that will help to illuminate the story. A few years ago, we worked on a bill, and Senator Favola has been working on this for a few years too. Right now, there are folks who are receiving Medicaid waivers for developmental disabilities, and because their parents who may pass away or are retired, that individual is eligible for SSDI or Social Security disability income, and that often puts them so close to the financial eligibility threshold that they are unable to have a job, even if it's a small job that is a part-time job. We're talking about maybe 5 or 10 hours a week, making 10 or 15 bucks. We've heard stories from families who have come to talk about how meaningful the jobs are to these individuals who work sometimes at Costco pushing carts in the parking lot. Or I have a constituent in my district who spends 4 or 5 hours a week going to a local coffee shop to roast beans there. And that eligibility is really what was in question for us, and trying to figure out how can we be flexible enough to allow them to work just the few hours without necessarily jeopardizing their financial eligibility to get the Medicaid waivers and services they need. This year is the first year in which the cost of living adjustment for Social Security disability income is so high that just being a recipient of the Medicaid waiver and having a parent who dies or retires is going to make that person ineligible for their Medicaid waivers that they've been recipients of for as long as they have. In 2019, CMS, or Centers for Medicaid and Medicare Services, finally granted authority for states to be able to count SSDI income specifically for these waiver users. And so we're hoping that this bill will help to address and make sure that nobody falls through the cracks and creates a safety net so that no one who is a recipient of Medicaid waivers is also going to lose their Medicaid waiver or their services just because their parent dies or retires. We certainly don't want to put families in the position of having to choose when to retire or not choosing to retire this year just because of a lack of protection that we have right now for these families. And so before 676 was amended, Madam Chair, they were identical. They were identical before it was amended. Correct. And Madam Chair, if I might.
That you now have a substitute that's identical to Senator Evans, except you add language that would ensure individuals are not removed from the rolls until the reenactment.
I would say, Madam Chair, it's not identical to Senator Evans' bill because Senator Evans' bill requires us to reenact it before the protections can be put in place for these individuals, whereas this substitute that's been prepared, I hesitate to call it mine, but this substitute that's been prepared says that we can enact the provisions of this bill now and then reenact it again in 2025 because, and so they are not identical, I would wait to say that.
They're similar, yeah, that's about where my notes were, that we were going to continue serving, nobody would be disallowed, and then we would come back.
I would
to
ask council if council wants to expound on that further. Yeah, sure. I'm happy to offer the substitute for folks can look at the language.
I think we have to adopt this, and then I think we're going to have to conform, you're going to go into conference, we'll have to conform.
I think if this, because this amendment, Madam Chair, because this amendment makes it different and it puts us in a different posture than Senator Evans, I think that we will ultimately end up in conference anyways, but I hope it will be the will of the committee to take this amendment over what was put on Senator Evans, because this allows us, at least in the immediate and forthcoming future, to be able to protect folks.
Madam Chair.
Substitute.
First, move the committee substitute, and Madam Chair,
Thank you. All those in favor of the committee substitute signify by saying aye.
and so Madam Chair, procedural inquiry. I just want to make sure with the substitute before us, I understand what the delegate is asking for and what our action for consideration is. I believe I heard her make it clear that our policy goal is to allow for the effects of the legislation to move forward while retaining the opportunity to act on this during the 2025 session, which, if I further understand, that would mean we would not be conforming to Senator Evans' bill. Is that correct?
That is correct. So we would have two different bills.
Thank you.
But at the end of the day, we would hope that we would want Senator Eben to adopt your bill. So,
Yeah.
so we would want, to get you into conference, I believe, I'm sorry, I would have to conform your, Senator Eben's bill to your bill, then you reject it,
That's correct.
okay? So that's the process. So we've adopted this, and now I would like an amendment to conform this bill to Senator Eben so they can
Madam
go to
Chair.
conference.
Madam Chair, I believe Senator Evans' bill has to be conformed to this bill because we're saying we agree with this policy effort.
Yes, if I can do that. To be recommended, okay? Good enough, we can do it the other way, that Senator Evans' bill would conform to this bill.
Correct.
And then it would just put the onus on the other party. Fair enough.
The
Okay.
other chamber will take
Madam
that
Chair.
responsibility. Yeah.
I would move that we recommend the substitute to House Bill 908 be reported by the full committee.
Second.
Okay, will the clerk please call the roll on that?
Senator Durant? Aye. Senator Aird?
Aye.
Senator Bagby?
Aye.
Senator Suderline?
Yes.
Senator Favola?
Aye.
Ayes 5, no 0.
Okay,
Thank you, Madam Chair and members.
go ahead. See what happens. Stay tuned, delegate.
Just go. Senator, I have 3 bills, Madam Chair.
The Hope docket.
The Hope docket, yeah. I have 3 bills before you, and I'll start with House Bill 354. House Bill 354, very simply, it just builds on existing authority for the Virginia Department of Health to be able to regulate neighborhoods, swimming pools. Right now, they can't regulate the swimming pools, the neighborhood pools, but they would look at things such as fecal matter to make sure that that is out of the pools. That seems to be an important thing that we should give them authority to. Water clarity affecting the ability to see swimmers in distress underwater. We certainly want to see someone certainly at the bottom of the pool if possible. Life-saving equipment, so you might need a reaching pole to assist someone that's drowning, that's in progress. Or just general sanitation or cleanliness of facilities. There might be algae or broken glass at the bottom of the pool. And so this would just allow them to have those things. Only 19 Virginia jurisdictions have a code. They're well over 100 jurisdictions statewide. So a lot of jurisdictions, and ours, Senator, Madam Chair, in Arlington does have oversight, but there's a lot of different jurisdictions that don't. And VDH, and this would not supersede those areas, but VDH would go cover those areas that don't have oversight of it. We are an outlier when it comes to not having the proper oversight. There's only three of the 26 states east of the Mississippi River, only 3 states, Alabama, Mississippi, and Vermont, currently do not have standards that cover these neighborhood pools. So again, we're just expanding existing authority that VDH already has over hotels and spas to include neighborhoods pools that many of our constituents swim in. Well, they have cited in a 2023 report, the VDH, a 2023 agency review, made the recommendation that the agency be granted relevant authority and oversight over general operations, maintenance, management, and safety to reduce injury, illness, potential at public pools and other aquatic venues.
Is there anybody here from?
I don't believe so. I don't know that they have a position on the bill, but I know that there are people here to speak in favor of the bill. You want to call them up?
Anybody like to come forward to speak in favor of the bill? Please be brief. Keep your comments perhaps to less than 2 minutes each. Please state your name and any organization you represent. Welcome.
Good evening. I am Chrissy Fandel. I'm the Association Director of Aquatics for the YMCA of Greater Richmond. I also am a part of the RVA Aquatic Professionals Group, and we're here and standing in support of this bill.
My name's Ted Quinn from Swim RVA, and along with Chrissy and others, including the Red Cross, the universities in Richmond, the swim management companies, the competition facilities in Richmond area, the VLA, the Virginia Life Saving Association Dan's a part of, have all been in favor of this for years. The Department of Health has been great in outreach and asking for our support for learning about our industry. We need this. Dan can talk about the history of what it's like in Tidewater before and after similar legislation has allowed oversight in his turf. But just this week, I had people from Virginia, Maryland, Tennessee, and New York this week training them. They're all blown away that we don't have any sort of oversight in a state basis for this kind of stuff. It's basic stuff. We need it. Thank you.
Thank you. Yes, sir.
Hi.
Hi.
My name is Dan Jones. I'm with the Virginia Lifeguard Association. I'm the president and founder. I also work for the city of Norfolk. I've been in the city of Newport News. I've been in the field for about 40 years. Served on national groups such as American Red Cross, CDC. We wrote a series of regulations that are adopted by local health departments and health departments across the country. Keep this in mind. Right now, the health departments don't have oversight over swimming pools and don't have the authority to close them if the pool is so cloudy we can't see the bottom. I've been a part of over about 1,000 water rescues, resuscitations in my career, and that we cannot close pools in certain jurisdictions if we can't see the bottom. Okay, think about that. And if there's fecal matter left in a swimming pool, we have all sorts of protocols in Norfolk and Newport News because I helped write those. But in some cases, there's no oversight to close a pool when there's been accidents in the swimming pool and chemical imbalances in general. So that's what we're asking for, and we're supporting that type of oversight.
Madam
Thanks.
Chair.
Yes, Senator Aird.
I don't know if this is a question for the patron or for you, sir. I guess, let me just say at the onset, in no instances would I want anyone to be in a pool that has what you're describing and what the patron has describing as chemical imbalances, fecal matter, or lack of, safety mechanisms, any of that. But I guess I'm curious as to, with this additional oversight, is there a possibility that in smaller communities, you now could end up with pool closures where ultimately that was the only pool possibly in a community or in a neighborhood? For any number of reasons, they don't have, funding and or the support to do, some of the things you're saying are simple. I'm just curious about if that's a possibility.
It would be a temporary closure. So if you had let's say, for example, fecal matter found in a swimming pool or chemical imbalance, which would be unsafe and in some cases deadly to be in that swimming pool. So it's going to be a driving force for that operator, the managers or owners of that swimming pool to do the right thing. And then we can have, all of our citizens would feel secure going into a swimming pool knowing that it's chemically safe. And then there's actually going to be an education component that the health department can provide to educate those operators and require some training as well, some basic training. A lot of that is free. We teach a lot of free training classes for certified pool operators. So there has to be, for oversight, there has to be the authority to close a facility if it doesn't meet certain guidelines and standards. Otherwise, we're putting the public at risk.
I will just note that nothing that the state does would prohibit localities from implementing, say, more stringent regulations. So the state would establish the baseline, the minimum.
Absolutely, and because we all have them in most of municipalities, that's what we're already doing. And a lot of well-run facilities and hotels are doing it anyway, but they're doing it because they think it's the right thing to do, and it's because it's an industry standard. But there's a few. I work also as I volunteer as an expert witness for drowning cases. A lot of times it's in facilities that there's no oversight, and there's many times where the lighting has been improper, or there's been cloudy pools and they couldn't see a bottom or a child at the bottom of a swimming pool for hours at a time.
Okay, thank you.
Thank you.
Is there anybody wishing to speak in opposition to this? Okay, the bill is before us.
Madam Chair, I do have additional questions.
Okay, Senator Aird.
Thank you, Madam Chair. Delegate Hope, I was going to call you Senator Hope. Delegate Hope, in practice, I guess, would someone from the local health department then go out and sort of like inspect these pools? Like, what does this mean?
Maybe there's someone from VDH. I don't know if there's anyone from VDH that's here that might answer that question, how they would do that. I think they're probably the best people to ask how they are.
In some cases, actually, the localities do the inspection for the state.
Right.
Like with
for
food
that.
inspection,
For
like
the- yeah, for that. But for
restaurant
this case,
inspections.
I mean,
So,
how would the VDH?
very good question.
Hi,
Welcome.
Julie Henderson with Virginia Department of Health. Your question was,
I was asking, in practice, how would this actually be executed? Would the onus be on the local health department to go out and inspect these pools?
I think it depends on what regulation we pass. So if this bill were to pass, it would allow VDH to work with stakeholders to develop regulations, which could include inspections. We'd have to determine the frequency of inspections, the scope of those inspections. But our hope would be that we would work to create standards that the industry could comply with. And then that could include routine inspections, yes.
Thank you, Madam Chair.
Senator Aird.
Thank you.
Okay. Interesting. I don't have much of a fiscal statement here, but I guess well, if the state really does monitor, there would be fiscal impact. Senator Durant?
Yeah, I was agreeing about the fiscal impact I looked at.
Yeah. Okay, well, committee, the bill's before us.
Move to report.
Is there a second? I will second that. Will the clerk please call the roll?
Senator Durant. Senator Aird.
Aye.
Senator Bagby.
Aye.
Senator Suderline.
No.
Senator Favola.
Aye.
Ayes 3, noes 1, 1 abstention.
Okay.
Thank you, Madam Chair.
We will recommend that it be reported. I suspect the Finance Committee will want to see it, but they will tell the Parent Committee about that.
Thank you, Madam Chair.
Your next bill is?
Next bill is 514. 514 is a very simple bill. It would extend the sunset date to 2028 for the PANS Panda Council. This is a council that looks to educate for the PANS Panda, which is a neurological disease that is treatable. It needs to be caught early. but there's a number of kids that are susceptible to it, and this would allow for a public outreach campaign to not just healthcare providers, but educators as well, educate the public in our community about how to detect early and get treatment for PANS pandas. I know Senator Suderline is the chair of the commission as it is now, council now, and might have some thoughts on the extension, but that's the bill extended to 2028.
Are you the chair? Senator Suderline.
Thank you, Madam Chair, and to the patron. Yes, we didn't get House appointments during the previous term, and so thus we weren't able to hit quorum. But previously, I served as chair, and we first got this group together from legislation brought forward by then Delegate Fillercorn, and it was advocated strongly by then Speaker Bill Howe, who actually called each of us to encourage us to make sure this got through previous subcommittee that we're on now. And then it went forward and it was continued. And I think that if we're going to continue it, it's far better to do it through legislation like this than sometimes as it's through the budget. We've had debates on different things, and I generally like us doing it this way. So when you're ready, I'm happy to make a motion.
Okay, we're ready.
All right, I'll move that we recommend report of Delegate Hope's bill 514.
There's a second. Okay, will the clerk please call the roll?
Senator Durant.
Aye.
Senator Aird.
Aye.
Senator Bagby.
Aye.
Senator Suderline.
Yes.
Senator Favola. Ayes 5, no 0.
Thank you, Madam Chair. My final bill is House Bill 515. This is a pilot project that is focused on individuals that are at the state mental health facilities that are on the extraordinary barriers list. As a reminder, people on the extraordinary barriers list are people that are ready to be discharged but don't have anywhere in the community to go. This is a pilot project to target one healthcare facility, one state facility, to work with, develop a discharge plan and have the CSBs execute in one facility to see if we can start moving people off that extraordinary barriers list. And just a reminder, most of the people that are in these facilities are there largely against their will. They're civilly committed by maybe an emergency protective order, but they're sent there. Once they're stabilized and they're ready to go, they have nowhere to go, and they're just sort of staying put there. And I think they'd be better served in our communities.
Madam Chair.
Senator.
Delegate Hope, has the facility that this will be piloted in been determined?
It hasn't yet, no. And I'm working with the department who helped me get to this point. I don't know if there's anyone here from the department. DBHDS. Anyone from the department is here, but
It would be helpful. Is anybody here from the Department of Behavioral Health and Developmental Services who might like to speak to this?
Madam Chair, members of the subcommittee, Josie Mace, Department of Behavioral Health and Developmental Services. We are in support of this bill. We have worked with the delegate on this. And yeah, we are excited to keep that moving.
Madam Chair.
Senator Aird.
So I feel like you're not really answering the question.
No,
I'm
it's
sorry.
okay.
So how are you going about determining what facility the pilot will occur in?
So I'm not exactly sure. 100% honesty, we've been working with our subject matter experts on that, and I think it's just still a work in progress.
Thank you.
I might be able to make a stab at that. I mean, the people on the extraordinary barriers list are all over the state and in different facilities. And so you want to make sure you're targeting where you can have a partnership with the CSBs, because you want to make sure that whoever's receiving these individuals on the back end are able to receive them and have the placements in place. And so I think a lot depends on what's the best facility that meets that criteria, that has the most people that can be placed in that facility. And so it hasn't been determined as of yet.
Okay, there are some speakers. I think this is Colleen Miller.
Good afternoon, Madam Chair, members of the committee. I'm Colleen Miller from the Disability Law Center. The fiscal impact statement suggests that Catawba Hospital will be the one that will be selected for this. There are other pilot projects that are being tried in other hospitals for different parts of this problem. at any time, there are 200 people in the state hospitals who no longer belong there. It is contributing to the overcrowding in the hospitals, to the staffing issues in the hospitals, and it is depriving those individuals of their constitutional rights. It's a complicated problem, and this pilot program is really only going to be like nibbling at the problem, but at least it is a start, and we are grateful to Delegate Hope and to the department for being willing to try this. Thank you.
But Madam
The
Chair.
fiscal impact statement says that Catawba Hospital can absorb it.
Right, we're always surprised when we go to finance.
Right.
That's why I asked the
It went
question.
to appropriations. The same
Same
question.
thing, yeah. We always get surprises. Senator Aird. Well, I like the idea, and you were also patron of another bill, it's companion to mine, which does have another model for discharging where the three state facilities would actually do the discharge plan if somebody's there for 30 days or less, as opposed to the CSB's doing it. So we're trying different things. We're trying to move folks out into the community. The challenge is ensuring that there are some community-based services that can do the follow-up. So, and there's a report back to us. So my only question is, will the department have enough time to give us a good report? I guess they will by November 1st, 2025. Is that enough time? I'm impressed. They usually make me wait 2 years. Senator Aird.
Madam Chair, I guess this is speaking to the bill.
Sure, go ahead.
And I mean the bill, no harm, Delegate Hope. I think fully understand what you're trying to accomplish and fully understand the challenge that we're experiencing here in the Commonwealth. And so I commend the pilot effort. I think my concern is it feels like there's very little information that is finalized for us to agree to a pilot program. I mean, in looking at the fiscal distress, we're saying no additional staffing is needed, but it clearly states that Catawba Hospital will experience staffing challenges or additional workload burden. And so we're saying that maybe it's Catawba, maybe it's not, but if it is Catawba, this will be the environment. And so I'm just expressing that I would have loved to have additional information because this doesn't seem like enough for us to give the thumbs up to, but we'll keep it moving with hopes that that information will come. But I just want my concern on the record.
Statement says that Catawba Hospital might be the place where the pilot takes place. A report is due to the General Assembly, to the specific committee, so I think we can probably move forward.
Madam Chair?
Senator Durant?
Second.
Okay. All those in favor of reporting House Bill 515, recommending reporting to the committee? Yes, sir. Yes, you do. I was just going to ask you to. Thank you.
Senator Durant. Aye. Senator Aird. Senator Bagby. Aye. Senator Suderline.
Yes.
Senator Favola.
Aye.
Ayes 4, noes 0, abstentions 1.
We will make the like recommendation to the parent committee. Thank you.
Madam Chair.
Okay, we're moving right along here. Let's see. I think I see Delegate Price here. Delegate Price, do you have a substitute for us?
Madam Chair, no, but I would like for House Bill 609 to be conformed
to Senate Bill 237.
Oh, is that what y'all do? Okay, yes, then I do. I'm sorry.
Second.
All those in favor of the substitute signify by saying aye. Okay. So this now conforms to Senate Bill 237, and I believe Senate Bill, what was the vote by which Senate Bill 237 was reported out? I don't have that in front of me.
Party line.
It was 21 to 19.
It was the right to contraception, of course. Okay. Well, we heard this bill. Senator Hashmi was the patron in the Senate. It got a robust hearing. I like the bill. We all know what's in it. I will second that. Senator Suderline.
Thank you. Thank you, Madam Chair. Appreciate the bill. This is basically the same thing I said when we heard the other bill. But I appreciate what the patron's trying to do. And especially in the Senate one, we had both contraceptives bills come from Senator Hashmi. And I was happy to vote for the one where we expand access to contraceptives, and I was happy to do that the year before. I just have a few concerns about making things positive rights and going down that path. But I appreciate the delegates' general effort, because I think we need to make sure that we get contraceptives to folks. So appreciate that. And
Madam Chair.
Yes, Delegate
and
Price.
I would just say, because I did hear the gentleman's comments on the floor and just wanted to make sure that we were having a full comprehensive conversation to add to that it's not just to prevent pregnancies, but also I stand here before you with polycystic ovarian syndrome, and without contraception, I would not be able to leave my home. And so as we're having this conversation, when someone says that we're going to come after, the Griswold decision, then it's people like me that want to leave the house on a daily basis that really do need that affirmative right. And so I appreciate your perspective and just wanted to offer mine.
thank you.
Thank you. Senator Durant. Did you have a question? No. Okay. Okay.
You have the motion pending.
I have the motion pending, and I am going to ask the clerk to call the roll.
Senator Durant?
Nay.
What'd you say? Nay. Okay. Senator Aird?
Aye.
Senator Bagby?
Aye.
Senator Suderline?
No.
Senator Favola?
Aye.
Ayes 3, noes 2.
We will recommend reporting your bill.
Thank you. Have a
Thank
good
you. Okay. This is how it's going to go. Let's see. Delegate Delegate I don't see. And I had Delegate Cole here, but he
That's right there. He's behind the.
Delegate Cole? Could barely see you. And then, yep. Delegate Cole, 1423, right?
Thank you so much, Madam Chair, members of the committee. Give me 1 second. Thank you so much. So before you is HB 1423. This bill comes from the status of Virginia facing a care crisis. Home care workers are struggling with low wages, and unfortunately, this disproportionately affects women of color. The Department of Medical Assistance Services has recently released a new dashboard with information on this topic, and it's imperative that we codify these requirements both for long-term clarity, but also to ensure the government maintains permanent transparency. So all this bill would do would require the department, DMAS, to place this information on the dashboard on their website and keep it updated. So I just hope it will be the will of the committee to report to full committee.
Can I ask a question?
Senator Suderline.
Thank you, Madam Chair.
Yes.
I think someone from DMAS is here. I just wanted to hear if they share the same, if they would also succinctly describe it as codifying the current practice.
Mr. Frank.
Madam Chair, Will Frank with DMAS. Yes, we already do this. The dashboard is live. And so this would be codifying what we currently do.
So you agree?
Move to report.
Second.
There's nothing wrong with putting this in statute if you already think it's a good idea. Okay, a motion has been made and seconded, and if you're already doing it, there should be no fiscal impact. Senator Durant.
I'm so sorry. I just have one more question for
Mr. Frank, would you come back, please?
I apologize, Madam Chair.
Sure, no problem.
Yeah, Madam Chair, just a question. Will this change anything that's already being in practice in terms of, I guess, some of those rates? Is there anything that could fundamentally be different?
Madam Chair, I'm not, I don't believe so. I think we already do this. This is just putting in the code what is already in practice.
Okay, so you don't expect any different outcomes from already what's being customary in place?
I'm not aware of any not necessarily looking to the future of if the dashboard changes, how this would respond to that.
Yeah, okay.
To be fully honest, though, not that you're not Mr. Frankman, my apologies if it came out inelegantly, but I mean, what this would do now is say, well, you can't just change your mind and not put it on the website. Now it's in code. So although they're doing it now, who knows what they would be doing in the future if they would continue to do it, but this is in code, so they would have to do it.
Madam Chair, so
Senator Suderline.
so I understand it, it's just to make sure that the decision that they like that the Youngkin administration made, they want every other administration to follow the day one game plan. Is that right?
Don't kill this bill, Senator Suderline.
It may have been built before before Delegate Youngkin. Oh, Governor Youngkin. Just kidding.
End of a long day, Madam Chair.
Senator Durant, did you have another comment or did you have an amendment?
That's enough. Thank you very much, Madam Chair.
You finished? Okay, so the bill is before us. Again, there's no fiscal impact. It's something that we seem to think is useful, and so does DMAS.
I think she made a motion, so I'll second.
You did? Did you second it? Okay. Will the clerk please call the roll?
Senator Durant?
Aye.
Senator Aird?
Aye.
Senator Bagby?
Aye.
Senator Suderline?
Yes.
Senator Favola?
Aye.
Ayes 5, no 0.
Thank you, Madam Chair, members of the committee, and I have one more bill.
Well, that's good. All right, let me see where I have you down here. Yep.
Is it 252?
252. And if I could ask for clarity, Madam Chair, I believe 1318 was conformed, and so we're no longer just making sure.
1318 was conformed, so now where would you like us to go?
All right, HB 252, Madam Chair.
Okay, we're here.
All right,
That's a
HB
sickle cell?
252 is a bill to create a sickle cell registry to be maintained by the State Health Commissioner. Combating sickle cell anemia is a long overdue issue, which in the Commonwealth of Virginia disproportionately affected Black Virginians. But I want to be clear that sickle cell disease does not only affect Black Virginians. In the United States, 1 in every 365 babies who will be born with sickle cell disease. For white babies, that chance is 1 in 333. Unfortunately, for Black babies, that chance is 1 in 13. So this registry will provide much needed help to sufferers, connecting those with the disease to resources on healthcare, behavioral health, clinical trials, and more. And this is a good bill just to make sure that the Commonwealth knows who's in the state, what the services are that they need, and that those people in the state know what services are being provided to them as well. Thank you, Madam Chair.
Thank you, Delegate Cole. I think my colleagues have some questions. Senator Suderline.
Thank you, Madam Chair, and I thank the patron for bringing this very good bill to us. I've got two different questions. Madam Chair, the first question I'd like to ask the patron is, I like this. Is it in the House budget?
It is in the House budget.
Do you know if it's in our budget?
I do not.
Okay. All right. My second question, Madam Chair.
Senator Suderline.
Thank you, Madam Chair. I'd like to ask the patron, I like this. I'd like to see it go forward, and I think that we might get actionable advice from it. So on line 80, I want to know if he'd think it'd be friendly if we struck December and made it November, which the policy I've been trying to push as much as we can in education and health is to always get the reports back at least a few weeks before the pre-filing deadline. So patrons that want to take that helpful, actionable advice can do so. So if he likes that, unless there's a reason it needs to be December, I'd like it to be November.
No, I think that's fine.
Second.
Okay. All those in favor of the amendment by changing December on line 80 to November 1st?
Yes, ma'am.
All those in favor signify by saying
Aye.
We got some work ahead of us.
As amended.
Okay.
I'd second that.
Motion has been made to report and the amended bill. There's a second. Will the clerk call the roll?
Senator Durant. Aye. Senator Aird. Aye. Senator Bagby. Aye. Senator Suderline.
Yes.
Senator Favola.
Aye.
Ayes 5, no 0.
Okay. Very good.
Thank you, Madam Chair, members of the committee.
Thank you, Delegate Cole. Senator Hodgins. No, Delegate Hodgins, rather. Did I promote you? I don't,
I don't know if they see it that way, but.
they may not. 1431,
Yes,
right? Is that your bill?
Thank you, Madam Chair, members of the committee. House Bill 1431, there really is a critical need for legislation that addresses the approval process for alternative on-site sewage systems. In particular, what we focus on is treatment level 3, or what we call, and I'll refer to as we talk through the bill, TL3 systems or TL3 units. These systems are actually the pinnacle of wastewater treatment. There's significant benefits in terms of organic matter removal, nitrogen reduction, and crucial factors in safeguarding the environment, and particularly the very delicate Chesapeake Bay watershed. Currently, the approval process for these TL3 systems, it's very burdensome, it's time-consuming, and it hinders really the adoption and the utilization of these systems. This bill really seeks to streamline that process, ensuring that high-performing TL3 units can enter the market swiftly and effectively. So approximately 40% of new single-family homes in Virginia, they rely on on-site systems, septic systems. And the TL3 units actually can remove a staggering 95% of incoming organic matter, meeting stringent nitrogen reduction requirements and help protect the Chesapeake Bay watershed. So there's really, in the approval of these systems, it's really divided into two categories, the non-generally approved and the generally approved. But the path for the generally approved is very cumbersome, it's arduous, expensive, multi-year field test programs, and this delays these TL3 products entering the market and limiting the options for consumers, designers, and installers. So this really offers a solution, and it proposes an expedited general approval process for conforming TL3 units and eliminating the need for the lengthy field performance evaluation, really going to national standards is what we're looking at, that it's already been pre-approved, they've gone through these standards, and the impact will be very profound to protecting the Chesapeake Bay, getting these to the market, and that's really the bill in a nutshell. I can go on and on and on, but we're trying to streamline it, make it easier for consumers, make it neat for everyone, protect the Chesapeake Bay. And I do have some folks from the department to speak to it. We introduced the bill, and now they're on board and like the bill.
I do think it's a good bill. Let me ask my colleagues if they have any questions.
Yeah, I don't like it. Hodges, water stuff.
Yeah, well, we're protecting us all, aren't you?
We're working
Okay.
on it, Madam Chair.
A motion has been made and seconded to report the bill. We will be recommending reporting it to the Ed and Health if the vote turns out favorably. Will the clerk please call the roll?
Senator Durant. Aye. Senator Aird.
Aye.
Senator Bagby.
Aye.
Senator Suderline.
Yes.
Senator Favola.
Aye.
Ayes 5, no 0.
All right. Thank you, Madam Chair.
Thank you. Okay. Delegate Washman. Oh, welcome. I didn't see you.
Thank you, Madam Chair. I'm sorry. I was
My apologies.
followed the instructions and sat front and center, and I realized that's behind the podium, so you can't see me. Madam Chair, members of the committee, it is my pleasure to come before you today to present House Bill 93 on alpha-gal. Alpha-gal is a tick-borne disease. Virginia is a hotbed of this tick-borne disease. It's very unusual. This came as a request from one of my constituents, hit a home with me because about 7 years ago I developed it myself. Starts off with a tick bite. Anywhere from 1 to 3 months later, you start getting allergic to anything with alpha-gal sugar in it. Alpha-gal is a mammalian sugar that's commonly found in red meat. You end up ingesting a product with red meat. I was also sensitive to dairy products, and anywhere from 4 to 6 hours later, you break out. And in my case, it was hives, swelling, and inflammation. And in some cases, about 50% of the times, these individuals go to full anaphylaxis, which can be quite abrupt and life-threatening. It's anticipated about 450,000 people in the United States have this disorder, but we don't know the answer for how many that is because there's no surveillance of it. What this bill would do was, following some of the new CDC and CMS guidelines, to have Virginia report that on a 2-page form so they can start collecting this data. Currently, there's only one other state in the country that's doing it. New Jersey's doing it on a volunteer basis. Virginia recently passed their worksheet on tick-borne illnesses. They've agreed that the tick-borne disease in Virginia that just came out late last year, they've indicated that this is an area that we need to move forward on, possibly bringing in somebody to surveillance. I am just amazed how many people, once this hit the news, that this was really come out. It made the front page of the Sunday edition of the Richmond Times-Dispatch. A lot of the other papers in the state made this the same thing. It's just something that not a lot of people know about, but those are affected. For me, it only lasted about 3 years. Most people, they have it a lifetime. I still test positive, but I'm symptom-free now. You go into a restaurant and you have to dissect everything on the menu to see if it has butter in it or dairy or any type of meat. It's a very difficult disease. I've received a letter from several different national and state organizations in support of the bill. The Alpha-Gal Syndrome Awareness Campaign, Tick-Borne Conditions United, National Capital Lyme and Tick-Borne Disease Association, Center for Lyme Action, Bay Area Lyme Foundation, Live Lyme Foundation, Lyme Disease, and the Food Allergy Research and Education Committee. What this bill would do would be require the physicians to report those patients that test positive for alpha-gal. And it's so important. I actually have 2 people that came all the way from Blacksburg today to testify if that's allowed.
Sure, we will take testimony.
Okay.
Thank you, Madam Chair and members of the committee. My name is Candace Mathis. I'm here with Debbie Nichols, and together we are 2 Alpha Gals. We run a blog, we run a podcast, and a food allergy mentorship program for the Alpha Gal community. As new friends, we were diagnosed just a few months apart from one another in 2019. Before I was diagnosed, I had been living with a cycle of constant anaphylactic reactions for months. I visited various specialists. No one recognized that I was in anaphylaxis because my anaphylactic reactions involved my blood pressure dropping, lightheadedness, heart racing. I woke up to the room spinning and seeing double. I was sent to UVA, and so under the recommendation of Dr. Platts-Mills, who actually was the founder of alpha-gal syndrome, I received a proper diagnosis then. We'd like to highlight several details that set alpha-gal syndrome apart from other food allergies. First, it often presents with a delayed reaction 2 to 10 hours after exposure to mammal or mammal byproducts, making it very difficult to diagnose. Second, mammal is hidden everywhere, from byproducts to your toilet paper, your toothpaste, your alcohol. We could go on and on. It's pretty much everywhere. It's in our food, it's in our medications, and it does not have to be properly labeled. We can even react to fumes to mammal cooking. Third, because it's associated with a tick bite, it is potentially preventable with expanded tick bite prevention education. And Virginia is a high prevalence area, but without proper surveillance, we can't understand its true prevalence. Thank you.
Thank you so much. As Candace mentioned, I'm Debbie Nichols. And for me, I recognized a problem with red meat after a wedding in 2015. I woke up in the middle of the night and I had the most severe GI pain I could possibly imagine. It just felt like my stomach was splitting in half. And this was after years of living with periodic GI distress, severe joint pain, brain fog, hives periodically. And from that time in 2015, where I had these symptoms, it was still 4 more years before I was actually diagnosed with alpha-gal syndrome. In 2023, the CDC reported that 78% of physicians surveyed in the US had little to no knowledge of alpha-gal syndrome. Our community's biggest challenge is not giving up bacon and cheese, and we have asked. It's the dismissiveness of their healthcare professionals or the lack of knowledge when it comes to diagnosis and management. The potential for contamination in prescriptions that don't have to list their ingredient sources. The fear of surgery or general procedures like going to the dentist because of the risk of receiving a medication that could trigger anaphylaxis. It's happened to both of us repeatedly. Alpha-gal syndrome is the #1 tick-borne condition in Virginia, and 95% of tick encounters in Virginia involve Lone Star ticks, which is the tick responsible for transmitting alpha-gal syndrome. The CDC has identified AGS as a growing threat to public health, and for which it has determined a critical need for improved surveillance at the state level. In high prevalence areas, alpha-gal syndrome is the #1 cause of anaphylaxis in adults and the #1 cause of adult onset food allergy. Surveillance is needed to develop and expand community education on tick bite prevention, develop healthcare practitioner education to improve timely diagnosis and management, and aid in public health decision-making. So we ask you to please help make our world a safer place by supporting HB 93. Thank you so much.
Thank you, Madam Chair. I appreciate the folks coming from Montgomery County today. And
Is that your district?
it is. Now, they might live in Center Hackworth's part of Montgomery County. They might live in mine. But either way, I appreciate them being here.
We appreciate your visiting us as well.
And
my district's Arlington.
yeah, which is different. Unfortunately, it doesn't include Montgomery. But I just want to ask, I appreciate everything they said, and I'm trying to understand why the House added a delayed effectiveness date.
That is a great question. I didn't mention that. Actually, I put that in the bill originally. That is to give VDH some time they may have to bring a new staff person in. It's also going to take some time to notify the practitioners out there about this new issue as well, too.
I have a question. I noticed, I read the fiscal impact statement, and they do say they need an additional person. Is this in the House budget?
Yes, it is. And I found that physical statement kind of interesting because it comes out in the middle, budget amendment, not necessary. But
right,
then
but then if you read down.
Yes, yeah.
Yeah, we're used to that. Okay, colleagues, the bill is before us.
Move to report.
I'll second.
Okay, a motion has been made and seconded that we report this to that we recommend that Education and Health report the bill out. I expect it'll end up having to be re-referred to Finance as well. Will the clerk call the roll?
Senator Durant?
Aye.
Senator Aird?
Aye.
Senator Bagby?
Aye.
Senator Suderline?
Yes.
Senator Favola?
Aye.
Ayes 5, no 0.
Thank you so much. Appreciate it.
Thank you for joining us. Is Delegate Arnold here? Oh, my apologies if you had to wait. I'm sure you found our committee interesting.
I was enthralled, Madam Chair.
That's the right answer.
I'm trying.
Okay, is it House Bill 434?
Yes, Madam Chair.
Okay, great.
So,
I'm sorry if you had to wait longer than
No worries,
I would have
Madam
liked.
Chair.
Okay.
Madam Chair, members of the subcommittee, HB 434 is a bill that would require DBHDS to amend its regulations pertaining to inpatient substance use disorder treatment facilities and make them develop a valid discharge plan for individuals who either withdraw from the program or who are involuntarily dismissed from the program. The particular element that I'm trying to address here is that this plan calls for a way or mechanisms for the individuals receiving treatment to return to their home or to where they wish to go. Failure for the institution or facility to do this could result in license revocation, suspension, or civil penalties. This issue originated from my former district over in Carroll County, to where a inpatient treatment center is discharging individuals either involuntarily or on their own, and basically taking these individuals to the end of the property, and these individuals are left without any resources or mechanisms to get where they need to go. Some of these individuals are coming from the Eastern Shore, from Northern Virginia, from other parts of the United States, and it's caused and it creates a very tenuous relationship here between the residents and these individuals who are without, in a vulnerable situation and without the resources to get where they need to go. This bill's just trying to address this here and trying to assist these individuals getting back where they go. They're having as one of my constituents told me, they're put to the side of the road, not even given a bagged lunch to get on their way. I've worked with DBHDS on this issue. They're here and can answer any questions you may have.
It's certainly a very important topic, and I'm just surprised that folks would be discharged from a substance use treatment facility and not have any follow-up discharge.
My understanding, and DBHDS may be able to speak to this more elegantly, Madam Chair, is there is a discharge plan, but generally that discharge plan only contains follow-up medical treatment, arranging prescriptions, arranging for them to follow up with their local physician. These individuals that are suffering the incidents I'm expressing, sometimes they violated the terms or conditions of the place, and the facility can no longer treat them. My understanding from my constituents is that these individuals are being walked to the edge of the property, told they're trespassed, and there they stand, not knowing where they are or where to go with their luggage in tow. And this creates a series of problems. I think in the city of Galax, I think their homelessness population has increased from roughly 10 to about 150, so it's taxing their resources.
Facility, and the facility feels they have no obligation then.
That's my understanding, is that, that's my understanding.
That's very interesting. Do you have somebody from DBHDS here?
We do.
And Madam Chair,
Senator
for the delegate, I'm just curious, so with the plans being structured, are they specified to, I guess, the services and resources available in that community? So to ensure that the plan could be successfully implemented or adhered to?
Well, I think as far as what my bill does to the regulations is it takes these individuals who either said, I've had enough, I don't want to be here, let me go, or the individuals at the facility is saying, you're not accepting the treatment, or you're being a disruption, or you're causing problems for the rest of the population, out you go. And what my bill does is it just addresses these regulations that says, if you're going to bring them in, sit down with them, figure out a way, figure out where they're from, figure out a plan to let them go back should in the event they decide to leave or you decide that you can't no longer treat them in your facility. And it sets aside funds for that too. And I think DBHDS has talked to me about the language before you uses the word personal home. DBHDS said, that may not always be the best place for the individual, or that home may not exist.
The question, would this cover VARs and Oxford homes? They don't really offer treatment plans, but they do offer housing to individuals who are recovering from substance use.
Sure. Madam Chair, I do not believe it would cover VARs because they're not technically an inpatient facility, so I do not believe it would cover VARs.
This would only cover facilities that are licensed by DBHDS, and they're providing substance use disorder treatment plans, and yet not everybody is given a discharge plan if the patient is challenging or difficult or leaves before the treatment's completed, et cetera, et cetera.
Sure. Madam Chair, they may be given a discharge plan, but it doesn't currently provide for that residential aspect of it, of where they might be returned to once they are released.
I mean, it's just, I like the idea, although I could see a lot of problems in implementation. So if in fact the individual doesn't have a permanent home to go back to or was homeless, so would that burden the facility? Would the facility have to keep the individual until housing was found?
You may be able to answer this question.
I mean, I'm not sure I disagree, but I think facilities might disagree.
I haven't, Madam Chair, none of the facilities have reached out to me. What I would say is generally these individuals that are coming in, they are either having the facility that I'm aware of, and that may be wrong of me to assume that this exists across the board. These are individuals that either have Medicaid or they have family paying for this treatment. And so those are the individuals. the facility that brought this to my attention that my constituents was concerned about, I don't believe it was treating homelessness, or treating persons who were housing insecure or homeless at the time they entered treatment. My feeling is that as long as the facility is coming up with this plan and meets this, then they've satisfied the obligations and are not subject to revocation or suspension of the
So
license.
does DBHDS, do you endorse this? I can find a better word if that's.
Madam Chair, we received a position of amend from the governor's office, and we have not received an updated position since the patron updated the language.
So can you give me a clue? Is it?
I will say that the delegate has been very open to working with us to make sure this is up to par with regulatory language and all of our other issues.
So this is something you could implement if it were to pass?
Yes.
And may I stretch it a little further? Do you think this is needed or a good idea?
I think that the delegates' concerns are valid. I am not sure how widely this would be applied, but we understand the concern.
The only thing that gives me comfort here is the regulatory process is pretty robust, and a lot of stakeholders are at it, and you're going to hear from folks, and so I expect you'll end up with something that the stakeholders could agree to, and if it is a problem, I want it addressed. So that's all I'll say.
Madam Chair, I will also add our regulatory folks, our Office of Licensing is planning to issue regulatory guidance on this issue as well, specifically about including the individual's living situation if this bill does pass. So.
Oh, okay. All right. So thank you. It's been moved to report, and there's a second. We will recommend to see how the vote goes, but of course, we only recommend to the full committee. Will the clerk please call the roll?
Senator Durant? Aye. Senator Aird? Aye. Senator Bagby? Aye. Senator Suderline?
Yes.
Senator Favola?
Aye.
Ayes 5, no 0.
Thank you, Madam
Thank
Chair,
you.
members of the committee.
I'm glad it was worth your wait. Okay, and I think I just have one more. Is it Delegate Munden King? Oh, we've been waiting a long time. No. My apologies. Now, I have you down for a few bills here. 255 and 820, is that right?
That is correct, Madam Chair.
And, okay, which one do you want to do first?
255.
Okay. We will go to 255. Go ahead.
Thank you, Madam Chair. So House Bill 255 is a bill to increase access to sickle cell trait testing. As Delegate Cole shared earlier, sickle cell disease is commonly known throughout the Commonwealth, but sickle cell trait, which is those who have been known to have benign symptoms, has long been considered, harmless, but it is actually the leading cause of death in young African Americans in military basic training and has often created instant death situations for young athletes, including Quandarius Wilson right at Virginia Union, who died while practicing football about 2 summers ago. What happens is with sickle cell trait in certain conditions, it can morph into sickle cell disease and lead to immediate cardiac arrest and death. And so while we do a fabulous job with the newborn screening program, this will open up sickle cell trait testing to adults. I'm happy to answer any questions.
Practitioners would be expected to offer it.
Correct.
Okay. It's not a mandate, it would be a best practice kind of thing. Okay. Motion has been made and seconded. There's no fiscal impact because this would be done by the private sector.
Correct.
And maybe some of our public health departments or other primary care areas where they're doing preventive testing.
That is correct, and we've been given the all clear that there is no fiscal impact to
Yes,
do that.
and I do have that note. I'm going to second that. Okay. We have a motion to report, and there's a second. Let's see how the vote goes, and this would be a recommendation to the full committee.
Thank you.
Will the clerk call the roll?
Senator Durant? Senator Aird? Senator Bagby? Senator Suderline?
Yes.
Senator Favola?
Aye.
Ayes 5, no 0.
Thank you, Madam Chair and members of the committee.
Thank you. Apologize you had to wait. Let's go to your next one. Yes.
The next bill is House Bill 820, which is known as Terrence's Law. Terrence was a young man who sadly lost his battle with sickle cell disease in his 20s. And what we propose to do is create an annual review of new medicines and technologies for sickle cell. As many folks have heard about the new gene editing and all of the great technologies coming forward, this is a bill to do an annual review so that we can get those technologies and medicines and new innovations to people living with sickle cell quicker. And happy to answer any questions. And it does have a November reporting deadline, as I heard. It is November 15th.
It is November, I believe, right? Oh, my goodness. You are very, very dedicated here. Annual review, I think this is very straightforward, too. It's a November 15th, not November 1st, okay, just to get you clear, okay. I don't see any fiscal impact, or they're saying there's none. And they looked at your engrossed.
Are you ready for a motion?
Yeah, I am.
Second.
Okay. Motion has been made in a second. Hopefully, this is on its way. Will the clerk call the roll?
Senator Durant?
Aye.
Senator Aird? Senator Bagby? Senator Suderline?
Yes.
Senator Favola?
Aye.
Ayes 5, no 0.
Okay,
Thank you so much.
We will make that recommendation to the full committee. I will just ask the clerk, is there any other business to come before this committee? Okay, I'll have a motion to adjourn. There's a second. All those in favor signify by saying aye. Aye. We're done.
The Senate of Virginia, Richmond, Virginia.